we are also going to broaden focus on holistic health and will highlight the role of our Indian traditional medicines playing an important role in keeping our society healthier and preventing several diseases, and how it can also help building greater immunity against infections at time of pandemics. Let me introduce Dr. O.P. Kharbanda, who is the professor of and chief of Center of Dental Education and Research, professor and head of Department of Orthodontics and Dentofacial Deformities at All India Institute of Medical Sciences, New Delhi. He's a renowned academician and visiting professor at many global universities. He is also the director of WHOCC on Oral Health Promotion and National Center of Excellence for Implementation of National Oral Health Program. Welcome, Dr. Kharbanda, on this special show. I would request Dr. O.P. Kharbanda, and since Dr. Kharbanda, you are heading an important aspect of All India Medical Institute and also, with the ICMR, as you mentioned. And what I believe that the area which you are taking care of is also one of the most important aspect of human health. I think dental health is something where the multiple stakeholders play a role, but losing dental health becomes disastrous for the productivity, for the human lives, and also adds a lot of sufferings. So, Dr. Kharbanda, when we are doing this gratitude week and trying to understand the role of doctors at every part of our life, from womb to end of the life, how are you, contributing that we all keep, pursuing our life's potential happily, healthier, and what is, what are the areas where you are, making sure that the country does not suffer? Dr. Kharbanda.
So, thank you very much. First of all, I'd like to thank you, Kamal Narayanji, and your organization for considering me for this today's program. I wish to say that the dental diseases are one of the most commonest, as we know, and some of them could be life-threatening if there is a comorbidity like diabetes. They may cause other conditions worsen. For example, if you have a severe periodontal disease, you might have a poor glycemic control. And dental diseases are not just limited to teeth. They are related to the gums, to the oral cavity, precancerous lesion, so many other types of ulcers which need differential diagnosis, and so many diseases which can be first recognized in the oral cavity. For example, a person coming to us while we are doing his dental treatment is unable to breathe, means he may have obstructive sleep apnea, and so many cases we have diagnosed while treating dental patients. And so is a person may not be aware about his diabetic status, and from the smell of his mouth and the periodontal disease, we can suspect that he has diabetes, and many such patients get diagnosed. Many children who come with some delayed eruption of teeth have been diagnosed to have hormonal disorders. So a dentist has a very big role, actually, not only in doing what he performs in the oral cavity, but also recognizing the implications of body health through his mouth, or through patient's mouth, I'm sorry, and also the impact of oral health into the general health, which includes your cardiac, your blood sugar, your other situations. Now, with respect to COVID, I have made a small presentation. If you permit, I can share that.
Certainly, sir. We will be happy.
Now, what I'm going to talk is that what are the challenges for the dental profession, and what are the opportunities for the dental profession when life is going around COVID. And I would say, somebody said last week it was a doctor's day. some other person said it is a doctor's year. I think it is going to be a doctor's decade for the next decade could be dedicated to the healthcare workers who are going to contribute a lot, particularly in this crisis of pandemic. Now, what I wish to convey here is that the viral load of COVID is very high in saliva, simply because the bacteria or the virus tend to stick in the oral cavity, and COVID-19 is notorious to stick to the host cells through ACE2 inhibitors. And the other problem which we have in the oral cavity is that the saliva droplets get aerosolized while even loud talking, and more so with the dental procedures. So there may be small droplets, medium-sized droplets, or even large droplets. The large one may drop near the patient, and dentist has to work very close to the mouth. So in this situation, the virus transmission is to everyone, to the receptionist, to the healthcare worker, to the other individuals in the waiting room. And the most difficult part is from dentist to his family, or from dentist to others in the dental setup. So now we have to take care of all this. So what it has caused now, what impact it has caused on the minds of people, as well as minds of the dentist and the paramedical staff. And it has happened because every day we had a guideline, a new guideline coming from some organizations, from Indian Dental Association, from ICMR. I was heading that expert group, which eventually became a Ministry of Health, Government of India guideline. But what is now we needed to build is a trust between a dentist, his staff, and also with the patients. Now, patients have a problem. They keep on calling me, for example. I keep on getting calls. They want to ask so many things, but they do not want to visit the dental office, just with the fear, because if they visit the dental office, they may get infected. They may get viral infection. They may get COVID-19. So that is what is required. So a lot of procedures were described, and many of them were considered emergencies in dentistry, particularly the fast spreading infections from the dental abscess, which could lead to trismus, difficulty in opening the mouth, even to the extent that they can cause obstruction in the respiration, leading to Ludwig's angina and death. There are emergencies with uncontrolled bleeding and many more such situations where pain is not responding, pain of neuralgia, trauma involving fascial bones, multiple fractures, and sometimes you have fast spreading tumors which need urgent attention, beside other urgent conditions of cavitation and orthodontic procedures. So what happened? All of a sudden, then there was a surge of education. Everybody started educating the dentist. So Indian Dental Association, Indian Orthodontic Society, UNESCO chair, the dental institutions, local bodies, state dental bodies, everybody is trying to educate a dentist what he should do, even the public media, for example, DD News. So what happened? Dentist, out of this, he got more worried. He suffered from fear of getting COVID infection. And then he has to do modification of the clinic, which means a lot because new equipments were suggested, HEPA filter was suggested for the air conditioning, high cost of maintenance, and only emergency procedures were allowed. That means there is a very, very low revenue. There is a loss of revenue, but there is a more expenditure. However, many dental surgeons came forward and they upgraded their clinics, and they've been advertised as safe clinic, cost of PPE and everything. There was a system of remote dental care to be provided on telephone, remote triage, telephonic triage before the patient visits to the dental clinic. Most of the problems are sorted, no crowding, and the dentist knows with what problem the patient is coming. He keeps his instruments ready. And many dentists have, of course, served with the dental professionals to work with them, with the healthcare workers, even to take care of the COVID wards. For example, at AIMS dental residents, they are working in the COVID wards in duty and AIMS. And you may be knowing that Nar Dental Hospital in Mumbai was converted into an entire COVID ward and being managed by dental professionals. Consequently, many issues have come up. And one of the major issues which has come up is that how to conduct the dental education, because now each dental student is expected to perform certain number of procedures before he has been signed off to appear for the exam, for example. And if his quota of those procedures logbook is not filled, he cannot appear in the exam. So there is an issue, how to conduct education of dentistry, how to conduct exam in dentistry. And also, usually in dental examinations, they are competency based, where each student, or whether master's student or an BDS or master of dental surgery student, he is asked to perform a certain procedure on a patient and he is assessed on that procedure. Now, how to allow him to conduct that particular procedure in current times? So that has become a big issue. Examiners are not available to visit and physically present. Some system of remote examination was initiated when patients' records were shown through the video systems, and these new things came up. So that means a lot of innovations occurred during this time. Innovations occurred in two areas. One was how to keep your clinic better managed as far as sterilization is concerned. Many dental clinics were not equipped for that, so they had to re-equip themselves. They had to relearn all the process of not only standard sterilization, but additional procedures which were required for the prevention of COVID. For example, donning and doffing of PPE, biomedical waste management, also the management of the waiting area, and all those stuff has to be taken care, which are required for prevention of cross infections in a medical setup. Now, these challenges have been many, and I wish to say that the dental profession has used this as an opportunity. It has been an opportunity for the dental profession to think differently, provide a lot of consultations on remote, manage the patients much better, which has resulted in better management of time of the patient, as well as of the doctor, as well as in the clinic. For example, now most dental clinics would like to take a history of the patient on phone. They would like to know their medical health, general health, and before patient visits the clinic, they have to make it sure that there is no crowding. There is not more than one patient waiting. The clinics have to be upgraded from floor to the roof to the air conditioning. Everything has to be upgraded to the highest level of standards of sterilization. The procedures have to be changed. For example, all procedures which cause aerosolization. Most dental procedures produce a lot of aerosols. So newer equipment is being developed. New type of suctions have been developed, which would take care of the aerosols generated immediately. They can suck, and these type of innovations have taken place. So there are opportunities also to think laterally that how and when to prioritize the dental treatment. Here, I wish to also add that in some situations, the dental treatment cannot be delayed. And many of these procedures, other than infection, also have been those patients who are admitted and they need to undergo some kind of surgery, but they need a dental clearance. For example, a cardiac patients, they require a dental clearance before they can undergo cardiac surgery. Patients for chemotherapy, uncontrolled diabetic patients, they require a lot of oral health care and similar situation. So dental profession has stood the test of the time. They have worked hand to hand, and they have provided support, particularly in the institutions. And not only in managing the dental part, they have also been involved in the supporting the other healthcare staff in their endeavor. The risk with dentists is very high during dental procedures. So they have to, of course, undertake all those prophylactic measures for their health. Many of recently we lost one young dentist, although his symptoms were those of COVID-19, but his first test had come negative, so that is still under scrutiny. But we have lost recently one dental surgeon. So my thoughts and direction in this would be that this particular situation of COVID pandemic has made us to rethink the way we worked, rethink the way we lived, rethink we behaved, and this opportunity can be utilized in that aspect to change our behavior in many ways.
Thank you so much, Professor Kharbanda. And we are, happy to announce that Honorable Union Minister of State for Ayush, and he's an independent charge minister and has been leading the country's preparedness towards putting forward a better defense mechanism, not against only the COVID-19, but also with our neighbors.